This year, it's estimated more than 1 million Americans will travel outside the U.S. for medical care. Plastic surgery, ophthalmology, dermatology, and cosmetic dentistry are among some of the top procedures performed abroad. Many say, why not? Procedures are usually half the cost, and you get a nice vacation to boot.
I know people that have left the country for plastic surgery, and they do it because it's cheaper.
Cheaper, but not necessarily better.
Part of the problem with getting surgery in another country is they're using different devices, different injectables, and even different techniques.
Miami plastic surgeon Dr. Jackie Yee says she's witnessed firsthand the serious effects of medical tourism.
I've seen people that will get an infection, and by the time they make it back into the States, they've got the difficulty of trying to find a doctor who's willing to treat them. It's a bigger problem that patients realize.
Dr. Grant Stevens, a plastic surgeon in Los Angeles, says he's personally seen patients returning to the States with life-threatening medical problems.
They can range from simple things like a hematoma, that's a collection of blood, for instance, for a breast implant, to very serious things such as a blood clot when they're flying back, and the blood clot can result in death or a stroke.
South America, Cuba, Thailand. These are just a few of the countries using medical tourism to boost their lagging economy. According to PatientsBeyondBorders.com, a popular medical tourism website, the industry brings in an estimated $40 billion a year. Many people feel medical tourism has its advantages: discounted prices and the lure of recovering in a tropical paradise. Dr. John Gross from Pasadena, California, says it's a trade-off that's not worth it.
There are very few procedures that you're really recovered from in the time span of a vacation, and the added value and advice and counseling you get through the recovery period, I'm not a big fan of medical tourism.
Savings can run anywhere from 40 to 90% per procedure. However, you do need to factor in the cost of airfare, meals, hotel, transportation, and possibly insurance. Now the price tag is nearly even.
We have the best providers in the United States of America. The prices are very competitive, and they have recourse if something were to go wrong, if they were to have one of those unlikely complications.
Next time you're looking for a medical deal in another country, consider all the risks, from follow-up care to how much money you'll really be spending. It might not be worth the gamble after all. Carolyn Grimes, The Plastic Surgery Channel.